Hello and welcome to the Soft UK podcast. I'm Sonia and I'm the Events and Communications Officer for the charity Soft UK, which is a support organisation for families with trisomy 13, 18 or Patels and Edwards. Ahead of Baby Loss Week in October, this podcast today will be speaking to one of our parents, Kate Sonley, who has kindly and bravely agreed to speak about her daughter Amber. So welcome, Kate, onto our podcast. It's lovely to have you.
Hi, it's really nice to be here as well. Always
Great.
emotional, but yeah, any excuse to talk about Amber, as always.
Exactly. Any excuse, a lovely excuse. So let's start off with your story with Amber, um, from wherever you want to start with.
Okay, I'll run through briefly. I had two miscarriages. I've got an older daughter who's now 27. Tried again with my previous partner. We had two miscarriages and then got pregnant with Amber. Everything was looking wonderful. I refused any testing because, as far as I was concerned, she looked great on the scans. I'd never heard of Edwards or Patos. Down syndrome never bothered me. We got to our 20-week scan and it was suspected she might have a small hole in her heart, but everything else looked wonderful. So we got sent to Glasgow, and that is where they picked up further markers and suspected either Edwards or Patos. So I had an amniocentesis at Glasgow at 20 weeks, and 3 days later we found out that she had trisomy 18.
Hmm.
So obviously this is about baby loss, and anybody who's been in this situation knows how traumatic it is. It took me 5 weeks to be certain that I was going to continue with the pregnancy.
Mm.
I think deep down it was never really a question for me, but I had to give her that chance at light. I wanted to meet my daughter. Um,
Yeah.
and it was strange because you spend your pregnancy preparing for loss. You
Mm.
get told the chances of getting to birth are very slim. You prepare yourself for losing your baby whilst you're pregnant. I found myself setting dates, so I was determined to get to 24 weeks because then she would get her birth certificate.
Mm.
And then I wanted to stay pregnant as long as I could because I got to see her on scans and listen to her heartbeat. And I didn't think it was till I got to about 30 weeks pregnant I really started to believe that she could live, that she could make
Hmm.
it. So
Yeah.
so that's kind of our story in full. I was very lucky. I had a very, very good medical team around us. I was reading horrendous stories of families that were being encouraged to get a termination for medical reasons when they didn't really want one. Not that
Mm.
I would blame anybody for making that choice. It's incredibly difficult, and I changed my mind pretty much every hour on whether I was going to continue or not. Um, but when I decided to continue with the pregnancy, the support of the hospital was really, really important. It was important that I had a medical team who respected that. And when I decided that I wanted full interventions if Amber survived birth, it was really important to me that her paediatric team supported that as well. And they did.
Yeah.
I was very lucky.
Mm. It's so important to have that support professionally as well because we have a lot of families that come through that don't necessarily have it, and it's still unfortunately so common that people do get pushed into termination as not necessarily even a choice, just this is the next step if this is the diagnosis they get, which obviously we know it's just not true, and it shouldn't be that way. I guess it must be very different when you get given the news during pregnancy as opposed to after birth, at any stage, because you are effectively grieving a baby that you haven't even had yet, or
Yeah,
even still for me it was like a point where I had to grieve the baby I thought I was having. um, and you might have felt like that during your pregnancy because obviously you thought you were having a healthy,
yeah.
normal,
I
routine
mean,
pregnancy.
absolutely. And my second miscarriage in particular was extremely traumatic. So when Amber's pregnancy, and the thing was, even after Amber's diagnosis, people were saying, "Oh gosh, you look amazing. You're glowing. You look so." I mean, I looked healthy. My pregnancy was actually wonderful.
Mm.
Medically speaking, apart from Amber's health, I felt great. I felt glowing. I had quite a lot of pelvic floor pain and stuff, but yeah, my pregnancy itself was pretty straightforward. So getting her diagnosis, especially when we'd initially been assured that everything on the 20-week scan looked fabulous, apart from potentially a small hole in her heart. So then for 3 days later to go to Glasgow and then be told, well, no, actually, there's all these other markers. And to be told not compatible with life, I was told that at Glasgow initially. And it was contacting Soft UK that made me realise that that's not necessarily true. And, there's children doing incredibly well.
And how did you get to contact Soft UK? Did you find them on your own, or did you get
Um,
recommended by the
the
hospital?
hospital scribbled down the name of the charity for me. It wasn't even a leaflet. They just said, oh, you can have a look at this charity. They might be able to help. But your baby's not compatible with life. That's what I was told. So that was really hard. And then researching, I remember getting home that first night and looking online, and I had to turn the computer off after 10 minutes because it's terrifying. The next day I sat and I did a lot of research, and by the time I got the results through on the Friday, we'd had the scan on the Tuesday, I was pretty convinced it was Edwards syndrome from what they'd told me they'd seen on the scan. I thought, right, this is what it's going to be. And I spent a lot of time looking at parents on YouTube that had lost babies. You immediately go really, really black. So one of the mothers that I watched, she'd lost her child to trisomy 18, and she said while she was pregnant, the first thing she did was plan the funeral. And that's what I did with Amber as well. I planned her funeral while I was pregnant. It ended up being very different when we actually did have her funeral, because I'd assumed I would lose her during pregnancy. But I figured if I did that first, then that was out the way.
Yeah.
And then I could concentrate on the pregnancy.
Yeah, it's a hard thing to have to focus on when, you have to do it at the end as well, because
Yeah.
you wouldn't be thinking straight. Your emotions are all over the place. I guess when you thought it would be best to do it when you're sort of clear ahead,
Yeah.
do that. Did you
Definitely.
have a lot of support around you at home?
It was difficult because it was still sort of the tail end of COVID. Because of my age, I was 42, 43 during my pregnancy with Amber. I was already considered a high-risk pregnancy, partly because of my age, partly because of prior miscarriages. I was on progesterone till I was 18 weeks pregnant to support pregnancy. So I had really good support from the hospital. I had really good support from my daughter and close friends, but I'd also been told to pretty much keep isolated because of COVID. So I spent a lot of my pregnancy on my own. So friends would maybe come to my gate and see me, but nobody would come in the house. So really, it was mainly Corey. Amber's father, I don't really want to go into too much, but we did split up when I was 16 weeks pregnant, so a few weeks before her diagnosis, and we had very different opinions on how COVID needed to be dealt with. So there wasn't the support that I needed from him either, which complicated things.
Yeah, it must have been. I mean, it's just an added strain when you've had to have a baby during COVID, and then, of course, when there was something more to her condition as well. I mean, how
Yeah.
did you cope with that? Because you were fortunate enough to bring Amber home. How long after you had given birth to her that you brought her home?
So I was induced at 37 weeks, ended up having to have a C-section because, like a lot of trisomy babies, full labour sometimes can distress them, and it did with her. So we had a C-section. She was in SCBU for 5 weeks, doing really, really well. We got moved to the children's ward and I got placed in a room with her to learn her care, with the aim to bringing her home a week later. Unfortunately, during that time, she got taken incredibly ill, and that was when she was flown critically to Glasgow. So we spent another 4 weeks in Glasgow. She had a malrotation of a bowel, which was one condition that we'd never looked into. And it also turned out that she had had her bowel punctured when they were trying to fit a jejunal tube before they realised that she had this bowel malrotation, which is why she got so sick and we'd gone to Glasgow. So that surgery went really, really well. She had a lot of assessments into her airways at my request, and she was set really to get a tracheostomy fit for minor apnea. But unfortunately, she went into severe heart failure, and she was still too small for the surgery that she really desperately needed.
Mm.
And the surgery that they offered just wasn't really a good option for her. They didn't think she would make it through surgery, and they thought that even if she did, she would possibly get stuck on the ventilator. So at that point, we made the decision to bring her home on
Yeah.
palliative care.
Hmm. Hmm. Do you regret any of your decisions during your time with her, or you think you did what you needed to do at the time was
No,
right?
I think I did what I needed to do at the time.
Yeah.
Every decision that we made, every treatment or test, or she had 3 blood transfusions during her time. She had countless echoes.
Mm.
Everything was done with the view that it would have a good result for her and it would help her long term. Um,
Yeah.
but then it got to the point where the bad was outweighing the good. She'd been in
Yeah.
hospital for 10 weeks. I'd been at the hospital for 10 weeks. I'd been home for one night in 10 weeks. Um,
Yeah.
and I always wanted to bring her home. I didn't want her to get trapped on a hospital ward.
Yeah.
I wanted to be able to be home with my little girl and her family around us. Um,
Yeah. Well, it's
so
good that you made that decision for her to, be able to see her home
yeah,
that
I mean,
way as well.
there's always a what if in the back of my mind. What if I had gone for the alternative surgery? Um,
Yeah.
but all the consultants, and I mean, we had huge meetings at Glasgow, huge meetings with,
Mm.
my sister would be on Zoom from her hospital in Norwich, and we had all her paediatric team from Inverness on Zoom, and all of them were agreed that it wasn't really in her interest to have this surgery to put her through more when she'd already been
Mm.
through so much in 10 weeks.
Yeah,
Um,
exactly. You have to remember their age, I guess, as
yeah.
well. Yeah.
Um, so
Yeah.
I mean, we were offered a hospice place, but both hospice centres are about 2.5 hour drive from where I live. So I couldn't have had friends and family around so easily. I wanted to be with my dog as well.
Mm.
So the hospice in Scotland was just outstanding. I mean, outstanding. We had
Mm-hmm.
24/7 care at home,
Mm-hmm.
in-house care. And I live really remotely, so it was a
Mm-hmm.
huge achievement for them to have
That's
nurses.
really good.
We had nurses from all over Scotland coming in.
Mm. It gives you a relief as well, doesn't it? You forget that you're just on the go 24/7,
Yeah,
having a bit of relief with that kind of support that you know that she's in good hands, so you can just sort of have a bit of a rest, even if you're still in the room.
yeah,
It does help a lot, doesn't it? You
yeah.
forget to take care of yourself in the process.
Oh, yeah, yeah. I mean, I just didn't. My needs just were not even a
Yeah.
consideration for me, and I don't think they are for any parent. I think that when you have a child that is so medically complex, your
Mm.
needs fade into the background. They
Mm.
absolutely do. It's you do what you have to do, and you push yourself beyond all normal limits. Um,
Yeah.
and you
Your
become an
needs sort of become
expert.
their needs
Yeah.
because you don't have any other needs because you know you're not going to prioritize anything else but them.
Yeah,
So
you try and sleep and you try and eat because you've got to keep going for them, but it's just functional. It's not
yeah,
self-care. It's
no,
definitely
it's
not
not.
self-care. Um,
No, yeah, definitely not. When we were talking about this earlier because you mentioned Amber's birthday's coming up this week, and that is a big trigger for me when I have my son's birthday.
yeah,
I feel like it's really important for me to do something to mark it and try and keep it as happy as possible for me in my mind because I'm on every other day, effectively. So that one day I want to try and like keep it sort of celebratory and things like that. Is there anything that you do to market for Amber, or
Yeah,
do you
so
do anything?
we're doing the same as we did last year. So my daughter and I have had a collection for gift baskets for the Skaboo baby ward at Inverness. Um, and we did 5 baskets last year. We've only done 2 this year. With the cost of living crisis, we figured people would be hard pushed. But each basket is probably worth somewhere between 150 £200. And
Wow.
I have put in it things for the baby, things for memory making, things for the mums as well, because it's long
Hmm.
days when you're sat in hospital. Um,
Mm.
so we're delivering those on Thursday afternoon. We've already pre-arranged to go to the unit, and they are
Hmm.
for parents that are likely to be in hospital for long periods of time with their children. Um,
Mm.
and so we'll do that, and I'm spending the next couple of days. I'm going to be making her a cake, and we'll have a little party for her when we get back from the hospital. We've got balloons and
That would be
decorations
lovely.
and all
Yeah.
sorts, and people buy her presents for her garden. And so yeah, we'll
Mm.
have a few drinks and light a candle for her, and she'll have a cake, which I shall make.
Yeah.
Yeah,
Yeah. That would be
so
lovely. I make my son's cake as well because I
yeah,
always would have anyway. So it means so much more when it comes from you, doesn't it? Do you visit the Skaboo that she was in a lot, or have you been back
I've been back
often?
twice. I do have an open invite to pop in whenever I want to say
Mm.
hello. Yeah, so I have an open invite to pop in whenever I want. But I've only been back twice. The first
Mm.
time was after a meeting with her paediatrician. Um, and we went back to the wards, and I got to there weren't any babies in the intensive care bit, so they let me sit in where
Hmm.
she'd been. That was hard.
Mm.
That was really, really hard. Um, I've been diagnosed with complex post-traumatic stress disorder, so there's a lot of triggers for me in that room. Um,
Yeah.
but then we went back again on her birthday last year, and expected that to be as hard, but actually it made my daughter and I feel closer to Amber that day, going back and
Really.
being
Yeah.
there. Yeah. So we were both
Mm.
glad. It ended up being a really nice visit that day, and we were really glad we did it.
Hmm. Yeah. That's good that you felt different after another trip, and I
Yeah.
guess it makes it a bit easier as you go on. I think
Mm.
sometimes it's the thought of it all coming back, like all the emotions, the smells, and the noises and stuff.
Yeah.
um
I
I
think for
personally
me,
haven't been back
sorry.
because I was just saying, I haven't been back to the children's ward my son was in. I did once, and then it was really hard, and I just
Mm.
couldn't do it again. And I do want to go back because, like you, I do have an open invite. But it's just pushing myself back in there. I don't know if I'm even 8 years on. I don't know if I'm ready to
Yeah.
do it again. It's really weird, isn't it? You think that time will really make a difference, but
It's strange. I mean, Glasgow obviously is a lot further away from me.
mm,
Glasgow, no, I don't think I could go back to,
no.
because that's where everything went really badly wrong. It was where things went right for a while and then went horribly wrong. So
Hmm.
that would be a tricky one for me. And the children's ward as well. The first
Mm,
time I went back to Skaboo, they said, "Did you want to go to the children's ward as well?" And I was like, "No, no, I can't,"
mm,
because that's where she got taken really ill. Whereas
yeah,
Skaboo, when we were there were some really traumatic times, but it's also probably where we had our happiest times in those first five
yeah,
weeks. Um,
that makes sense.
so Skaboo I can go back to, but the other 2 wards she was on, no, I don't think I could. Not
Yeah,
now anyway.
yeah. What advice would you give any parents that are listening that are dealing with baby loss, whether it be, a year on or very fresh, or anything from what you're still managing to do at the moment?
So I mean, I'm obviously still dealing with the PTSD, and I suspect that a lot of
Mm,
parents will be, whether they've been
mm,
diagnosed or not. And I was lucky; I was diagnosed very quickly. I have been seeing a psychologist regularly, and having EMDR therapy. So I think for any parents that feel that they might have PTSD, EMDR is a fabulous therapy for trauma. It's not cured me, it's not fixed me, but it's definitely it's made things a little bit softer. It's taught me methods of coping. I do a lot of yoga. I spend a lot of time with my dogs, and I try and do sort of creative things. I do distract myself a lot, so I'll get into projects. I find that I struggle being in crowds, so that's normal. There's a select few people that I can be around. But it's really hard, especially like 2 years on, because people kind of look at you and they go, "Oh, you're doing so well. You look great. You look really well. You starting to get over things now." And it's like, no.
No.
So I think I would say to the parents, it's okay to not be okay. I feel that I am never going to get over this. I am never going to heal from losing Amber, ever. And part of me doesn't want to. She was my daughter. How can you possibly get over it? I just learn methods of coping with it.
Yeah.
I do a lot of breathing. I find it really difficult. The platitudes that people come out with when you've lost a child are really, really hard. It's not like any other loss. It's in a league of its own. So I would say to the parents, just be really, really gentle with yourself. And if you don't want to go somewhere, don't go. And if you need to deal with it, that's okay. And if you're smiling, laughing is really hard. I still feel guilty. I still feel guilty.
Yeah.
If I laugh or smile. But I talk to Amber all the time. She's part of my day-to-day life. She's still with me all the time. And I try and do what I can for her. My grandson started asking about her a lot, which is, he learnt her name about a year ago, but now he's like, where's Amber? That's quite tricky. I tell him that she's dancing in the stars, and keep
That's
watch
nice.
over him. But I think you just do what you can do to get through it. And I still take every day an hour at a time. I don't think there's any quick fix. I think it's self-care, and it's just being really gentle with yourself and knowing that however you find it best to deal with is the right way for you.
Yeah, I agree. I think enjoy the times where you are feeling yourself again just for that moment, because it's not going to be the same tomorrow or the day after. So the moments that you do feel like yourself again or a little bit like that, just embrace it, because it's always going to be quite turbulent.
I think it's okay. So I feel like I wear a mask a lot of the time as well. That you get up in the morning, and as soon as I leave my house, I have to put this mask on and pretend to be okay. And I've realized now that quite often people will say to me, "Oh, how are you?" And I always used to say, "Oh, I'm fine, I'm fine." And now quite often I'll say, "Well, actually, I'm not great, but I don't really want to talk about it right now."
Yeah.
And it's okay, and it's okay to have a breakdown and cry, and
it's good to be truthful about it, isn't it? Just be honest with it,
I
especially
think
with people who know what you've been through.
I think so. And I find that a lot of people get uncomfortable when nobody wants to talk about your child that passed away. But I just talk about her anyway. You definitely discover who your true friends are. And
Sometimes it's surprising, isn't it?
And sometimes I say to people, because people say, "I don't know what to say to you." And my tendency is to just say, "There's nothing you can say. You don't need to say anything. Just be with me."
Yeah.
Just be with me.
Yeah, exactly. Yeah. And I think that's the right way to say it. I mean, you said a little bit of how you've done different things since Amber's passed, like, and you've obviously touched on it. How has the experience changed you as a person? You're obviously a different person, aren't you, from it?
Yeah, I think I'm still trying to figure out who I am. I quit one of my jobs just because it was probably not safe to be working on a big blowtorch when you have PTSD, and also it was always a very busy job with a lot of people. So I
Right.
have I've taken a second job just working in a local fuel station, and I run a post office. So I see people in like small bursts, which I find I can cope with.
Mm,
But it's not where I permanently want to be. So I think I'm still trying to figure out who I am now. Um,
mm,
I don't feel like I've grieved for Amber yet.
mm,
My psychology is now coming to an end. I have one more session and then I have to have a 6 month break. And then they said, if you still feel like you need support, come back to us in 6 months. So I'm about to switch to bereavement support with the hospice to
mm,
keep some kind of support going. But
mm,
I honestly don't know who I am.
mm,
My energy levels, I've never been so low. I don't sleep. I still have insomnia. Um,
mm.
it feels there's a real sense of unreality at the moment. The world doesn't quite feel real to me. I don't quite feel part of it. Um,
Mhm,
so even when I'm with people, I often feel quite lonely and quite isolated. That's very new for me. Um,
mhm.
I think it's really difficult to reconnect with people when they don't understand what you've gone
Yeah.
through.
Mm.
Um, I think I
I
value
think you're
my
surrounding
own
yourself by
space a
different
lot
people
more.
now. Mm.
Yeah, I mean, I still have the close friends that I have. Some friends have fallen away. Um,
Mhm.
but the friends that I have, each of them gives me something different.
Yeah.
None of them understands everything, but each of them, in a way, kind of
Yeah.
understands a little bit. Um,
Mm.
my daughter, I worry about my daughter Corey because I think that she hasn't really dealt with it. It's been hard for her seeing her mum go through
Mhm.
this, but also losing a little sister, but with such a big age gap. She was
Mm.
25 when Amber was born, so it's been tricky for her as well, trying to
Mm.
navigate everything.
Yeah.
But she's my anchor, definitely. Her and her little boy are my anchors. My sister said to me, "You need to find an anchor. You need to find an anchor to
Yeah.
life." And my daughter and my grandson have definitely become that.
Yeah.
Um,
Which is great. Which is
yeah,
definitely you need a point to keep you grounded.
yeah. So
Mhm.
I just take time out when I need it, and
Yeah.
my friends all understand that sometimes I just need space by myself. I do a lot of self-care. I spend a lot of time in the bath. I
Mm.
don't think I've ever spent so much time
That's
in the
good.
bath that I do now.
Yeah, you definitely didn't have the time when Amber was there
Oh
to have a
no,
bath, was there?
no. I think I got one bath in the 12 weeks that I had Amber, and it was
Oh,
on a
good for
children's
you.
ward. And the nurse said to me, "There's nobody using the children's bath. Would you like one?" So I'm starting to
Oh,
be able to remember more of the happier times with Amber
the
because that
happier
was a big
memories.
struggle. Yeah. And
Mm,
I have her photo everywhere. We're surrounded by her things. Um,
yeah, exactly. They definitely keep you going as well. I think it's a good healing mechanism to have
yeah.
everything exposed and in front of you.
So I
But
think
yeah.
I wouldn't change anything. I would
Hmm.
do it all again.
Yeah.
I don't regret any of my decisions. I don't regret continuing the pregnancy. I would do it all again because she was worth
Yeah.
it. And I mean, everybody I think now knows Amber Little Fox. Um,
Hmm.
I'm still in touch with her pediatrician regularly. I'm still in touch with Martin McCaffrey as well, who
Are you?
he definitely guided a lot of my decisions and choices with Amber.
Hmm.
Um, and so did other families. I'm still in touch with especially two girls that I was pregnant with at the same time, Jodie and
Hmm.
Becky. If they're listening to this, they've been amazing as well because we all went through it around about the same time. Um,
Hmm. Yeah, and that's important. I think that's
yeah,
the good thing that's come out of it, that you've made new relationships,
I
and that's what
have.
you take on, don't you?
And soft as well. If I hadn't have contacted you, I think I had a Zoom call with Sean and Kate within a week or two of getting Amber's diagnosis. And
Mm.
knowing that there were so many other people out there who were either going through it or had been through it was, yeah, You find a new little tribe, and it's not one that you ever wanted to be part of, but it's a really special group of families and parents and that understand what you're going through. And it's like the support isn't just there during pregnancy, it's there afterwards as well, you know.
Yeah, absolutely. I think you couldn't have said it better myself. So it's a nice way to end the podcast, I think. So thank you
Yeah.
so much, Kate, for sharing your beautiful story of Amber. And thanks for everyone for listening. I hope this has helped any family that are dealing with baby loss at any stage of your journey. Um, whether you're an expectant parent, bereaved parent, family member, or professional, if you need support or information, Soft are here for you. We have plenty of resources and support on our website. So please reach out, and our contact details can be found at the bottom of the podcast blurb. Thanks again, Kate, and thank you everyone for
Thank
listening.
you. Thank you so much.